So now it's my pleasure to welcome Dr. Tina Fisher. Tina's Today is Tina's first day back. I know, sort of informally from maternity leave. She's actually still on leave, but is here to share some work related to communication that we're doing. Tina is a neonatologist here on our campus. She's an assistant professor of pediatrics. She is the co-director of the Define Collaborative and a real champion for families, especially around supporting those whose primary language is not English, and she will share some updates with respect to our divine communication work.
Thanks, Susan, and thanks to you all for being here today and sticking it out to the end of the day. I know it's a long day, but hopefully it's been as energizing for you as it has been for me. So this is hopefully not new news to anyone, but the Define team, with the support of all the hospitals, has been working to update our Define surveys so that we can capture data that is helpful, relevant, and actionable. And so really, for the last year, we've discussed shifting the focus of the surveys to include communication optimization based on feedback from you all. So it seemed like a good opportunity to look at our surveys as a whole to see what we can improve. And I'm really excited to share kind of version 2.0 of the Define surveys on a big picture scale. Thanks to all who have looked at kind of our surveys line by line and provided specific feedback. We really appreciate that. So two kind of pretty big changes. So prior to the new version, what enrollment looked like is hospitals had to screen their current census, see who met our inclusion criteria, add them to a list. Someone had to go and physically talk to the family, see if they wanted to be enrolled, and then go and add all of their information into REDCap, which we acknowledge is a huge lift for you all at the hospitals. So one exciting change that we are implementing with the new surveys is they will be completely self-enrolled, meaning the families will be enrolling themselves and entering all the information that they need to get all the subsequent surveys. So our hope is that takes a huge lift off of you all. Because it's self-enrolled, we had to have something that we could tie the subsequent surveys to that's not something we have to get from the chart, something that the families can enter themselves. And so we are tying our surveys to gestational age. So in its previous state, we had two surveys, one at time of enrollment and one that was sent 1 month after discharge. You'll see now we plan to have three surveys. So the first survey will be within 1 to 5 weeks of admission to a defined hospital. So this is really kind of the enrollment survey. We're trying to get a picture of what their experience is early on in admission. The second survey, which is tied to their corrected gestational age, will be automatically sent to families at 34 to 36 weeks corrected. And the reason we picked that range of gestational age dates is because we want it to be sort of closer to the end of a baby's admission. And this is where we can start talking about safe sleep questions, because hopefully infants at this point will be eligible for safe sleep. You may be wondering, my baby or my hospital admits a lot of babies at 34 weeks. So what do we do if the first survey they're getting is when they're already 34 to 35 weeks or later, 40, 41, 42 weeks? That is totally fine. That means they'll just get one survey, which will have all of the same questions that's on the first and second surveys with the inclusion of the safe sleep. So don't feel like every patient that has to be enrolled is a preterm infant. We can enroll term infants as well. And then the third survey will be administered and sent to families 5 to 6 months post their 42 weeks corrected gestational age. So this is hoping to get them once they've been home for hopefully many months from the hospital. And this was based on feedback from lived experience experts who felt that having more time between their NICU experience to really reflect and digest would mean we could get more helpful information from families. Other sort of things to take note, because this is a self-enrolled process, if both parents want to be involved and enroll, they absolutely can. It just means each parent scans the QR code. We also are excited to say that if a patient transfers from one defined hospital to another, we can continue to collect data on that patient. Whereas previously, if you were transferred to another hospital, whether it was a defined hospital or not, we were not tracking that data. So those are hopefully some exciting updates to the surveys and how we plan to collect data. So what are the survey domains? These are the big kind of categories or buckets of questions that we ask of families. The ones that have stars are new additions to the survey. So We ask questions about postpartum visit attendance. We have communication questions now, some more specific family engagement questions, and then some questions that get at the discharge process. So how did we update the surveys? So we looked at our current survey that we were asking families. We looked at what sort of validated surveys or tools exist in the literature that we could draw questions from. We looked at identified gaps. So what sort of information do we want to get from the surveys that we're not currently getting with the current surveys in their state? And then we also were able to meet with families through focus groups to get their feedback on what's important to them. What does family engagement mean to you? How can we ask about your family engagement? And one thing that we're very proud of and that I hope comes through on the surveys is kind of through each step, we were able to have family feedback. So this new version of surveys is really rooted in lived experience feedback and what we hope will be helpful for hospitals, but also easy for families to digest based on the questions that we ask. So as I mentioned, we were able to hold some focus groups to get feedback. So we had 3 feedback sessions, one through lived experience, and then we were able to attend a Denver Health Parent Family Advisory Council in addition to Children's Hospital Hispanic Family Advisory Council. So a huge thank you to Sarah from Love for Lily for organizing our focus groups, along with Blair and Clarissa for really getting this information from these various family advisory councils so that we could bring into the current surveys. Some areas that we really would love your feedback on, and we really appreciate those who've been able to look at the surveys and kind of look at things line by line, is we want to be cognizant of the length. So if you're going through these surveys and you find that questions may or may not be helpful, or they may be cut, or we're asking 2 questions that maybe are too similar, please just make note when you turn the survey in so that we can see if there's any questions that can be trimmed. The other thing I wanted to mention is our surveys have free text responses, meaning families can leave free text comments, which is different from our previous version, which I hope will have really rich data that we can then give back to the hospitals. But please, if you have any feedback on how the free text questions are asked, please let us know. And as it mentions here, I know you all have the opportunity to receive hard copies of the surveys with a highlighter. And if you want 3 raffle tickets entered to get a gift basket, please turn in your surveys because we would really, really love your feedback. And we're running out of time because we hope to go live with these new surveys by Q3, so July 1st. So we're really hoping that we can just put some minor tweaks on the surveys at this point, but would love your feedback, and getting feedback from you all is really our last step before we can build these surveys into REDCap. The other thing that I'm really excited for, I know Bernie mentioned all of the various other languages that patients speak at our hospitals. So right now the survey is going to be in English and Spanish, but we eventually hope to translate this into other common languages that our families speak so that we really can broaden it to more patients and families than just those who speak English or Spanish. So what is our ask of you? July is going to be here before we know it, and that is when we hope to start the process of collecting data again with these new surveys. So if you could start to think about what the process would look like at your site in getting patients enrolled, that would be great. We're hopefully taking away a lot of the lift by having it be a self-enrolled process, but our hope is that families can enroll with a QR code on a flyer, maybe not just that in of itself, but accompanied by a conversation. So could it be a defined committee member who goes around in the NICU once a week with a flyer? Could we hang flyers in your break room or in the family lounge? So what this will look like at each site would be different, but if you could start to think about how you can engage with families in a meaningful way through the self-enrollment process so that come July 1st, you're ready to hit the ground rolling and get families enrolled, that would be great. And with that, thank you so much for being here and for looking at our surveys.